Hello, I'm Professor Konstantinos Triantafyllou from the University of Athens. I'm here with you to discuss in brief our manuscript entitled High Definition Colonoscopy to Improve ADR, a Systematic Review and Meta-Analysis, accepted to be published in GIE. This was a project where worldwide known endoscopists participated. I'm here with Georgios Tziatzios, which is one of the two lead authors. George, will you comment on the study?
So the first question that comes to our head is, Professor Triantafyllou, please describe us the situation, how is with definition colonoscopy, and what was the main reason that urged you to perform this meta-analysis?
So while it's well known that high definition colonoscopy improves adenoma detection in clinical practice, it has not been measured yet the impact of this technology on ADR, which is the core quality indicator for colonoscopy. Thus, we decided to perform systematic review and meta-analysis, and to include in the analysis only randomized controlled trials, high quality studies, because there is in the past there is a meta-analysis where multiple type studies were included, including observational studies and RCTs. So this is the background. And now, can you describe us how was it performed and which are the main findings of the study?
So, along with my leading co-author, Dr. Paraskevas Golfakis, first of all, we had to write down our protocol and then register it in international database for systematic reviews. And then we went on and searched through multiple electronic databases for published articles, full-text articles, that comment on the exact impact of high-definition colonoscopy on adenoma detection rate. Overall, we found 6 randomized control studies enrolling approximately 4,500 patients. The main finding of our analysis is that high-definition colonoscopy significantly improves adenoma detection rate, and this finding is consistent also for advanced adenoma detection rate as well as sessile adenoma detection rate. On the other hand, our analysis did not reveal any significant impact of high-definition colonoscopy on other colonoscopy metrics like mean colonoscopy, mean adenoma per colonoscopy, mean advanced adenoma per colonoscopy, and mean sessile adenoma per colonoscopy.
And then we have two questions now about the results. One question is why we had this discrepancy among results related to endoscopy's performance and results related to lesion detection. This discrepancy between ADR and mean adenoma per colonoscopy. And the other question is that we had an interesting finding that although we found out that high definition colonoscopy improved actual ADR, the effect was considered rather modest, because we had a rather high number needed to treat to detect this advantage.
This is true, because our number needed to treat with our analysis is around 23. This means that you have to treat additionally 23 patients in order to detect one adenoma. Moreover, during our sensitivity analysis rounds, we found that this positive impact of high-definition colonoscopy on adenoma detection rate is only for endoscopists who already have a high ADR, more than 35%, and that perhaps this beneficial effect of high-definition colonoscopy was maintained only for the studies where more than 50% of the cases included were performed for screening purposes.
And we believe that the discrepancy between ADR and mean number of adenomas might be related to the one and done effect, meaning that probably endoscopists do not pay attention if they detect their first adenoma. And so we had some advantages and we have some limitation of the study.
That is true.
What do you think?
Well, the main advantage is that we acted on a pre-specified, predetermined registered protocol. We did include only the highest possible evidence in bibliography, only randomized control studies, and we tried to perform multiple sensitivity analysis. On the other hand, there are also some major limitations. The main limitations is that these studies enrolled did not contain any data regarding the morphology of adenomas. Another study limitation is that all the studies included different populations. There was main discrepancies regarding the population enrolled in each study regarding screening, symptomatic or surveillance colonoscopy. And of course, regarding our secondary outcomes, as already mentioned, we had to perform analysis only from data coming from 2 or 3 studies each time. So there is questionable about that result.
So we are not done. There must be some future, and the future comes with the availability of new models from many companies. So data is accumulating, and hopefully the results of the high quality randomized control studies would be such to give us a permission in the future to obtain more valid results.
So at the end of the day, what would you suggest to the reviewers of our journal? What do you suggest about people who are already using high definition and people who do not have access to high definition colonoscopy?
So if you are working with high definition colonoscopy, then that's okay. So you have a benefit. You also have a clear benefit regarding the characterization of the lesion. But on the other hand, if you don't have high definition colonoscopy yet, it's not a major disaster. So keep on other quality metrics, rather obtaining adequate cleaning before colonoscopy, taking your time, mind your withdrawal time, and you will get an improvement in your ADR.
So overall, our study has shown that randomized control studies meta-analysis showed that high-definition colonoscopy has a significant improvement, allows a significant improvement in adenoma detection rate. However, the evidence behind it is low, and more studies in the future are needed to better determine the exact impact of that on adenoma detection rate. Having said that,
we thank you for your attention,
and we send our greetings from Athens, Greece.